Okay, everyone, let's get started. Thank you so much for joining us today, this Friday on August 23rd. We have some exciting and wonderful information that's going to be shared today. I'm very excited about it. So a little bit of housekeeping for the beginning. You are here for the welcome to the Partnering with Schools for School Mental Health Leaders webinar series. This episode is going to focus on best practices in school mental health partnerships. We're really excited to have you with us. As you log in, we are asking folks to put in your name and location into the chat box. If you have more than one person joining you from the same computer portal, if you could put in everybody who's there, their name and location, and we'll use that as our sign-in sheet for the webinar as well as for our CEUs. So please sign in. You will receive a link to the course survey and the evaluation form for this and the CEU survey, the CEU certificate. It will be posted in the chat box towards the end of our webinar. So make sure to kind of stay on and look for that, and you can get your hour CEU. All right. Let's launch because we've got a lot of good information and I don't want to waste any time. We always like to kind of recognize our sponsor, the Substance Abuse and Mental Health Services Administration, who funds our Southwest Mental Health Technology Transfer Center. And today we have the privilege of getting to hear from Laura Soule and Monica Rodriguez, and perhaps Diana Zamora, she's able to join us, all from Tropical Texas Behavioral Health Services, as well as Jessica Gentry from Bluebonnet Trails Community Center. So they're going to be sharing some of their lessons learned and the best practices happening within their region.
Good.
Thank you.
All right. Well, good afternoon, guys, and thank you for having us. Again, my name is Monica Rodriguez, and I'm the program manager with Tropical Texas Behavioral Health. I'm going to go ahead and let my counterpart introduce herself before we get started.
My name is Laura Soule, and I'm also another program manager for Tropical Texas Behavioral Health.
So today we're just going to kind of give a run through of some of the things that we've been doing in partnering with community members across the Rio Grande Valley. We are in the lower Rio Grande Valley, and that catchment area is roughly, from point to point, it's over 160 miles. Just to give you a regional view, we have a very large service area, and we service 3 different counties. I like to joke that some people say we're from South Texas, and they're like, oh, yes, we're from San Antonio. No, like 4.5 hours south of San Antonio. So that's our area, that's our region, and we're just going to speak to what we've done in separate counties to kind of engage our educational system and partner to make this systematic change throughout our community. Really focusing on partnering with educators in multiple districts to enhance not only mental health outcomes, but looking at providing access to the community as far as services. So looking at how and where it started with Hidalgo County, I'm going to speak a little bit about Hidalgo County and the experiences that we've had in this area. And then Laura's going to go ahead and speak to Cameron County and Willacy. Because our areas are so large, it really takes a whole team to be able to do the work. A lot of legwork goes into preparing for movement in our community. A co-located school case manager project started in Hidalgo County with McAllen ISD. It's one of our larger school districts in Hidalgo County. And we really wanted to make sure that a partnership existed because what we found is that services were greatly needed. There was community conversations at the local level that there weren't enough services provided to students on campus or off campus. And so creating those conversations early on helped us to really have these bigger partnerships that include co-location. So case managers, counselors provide services on campuses throughout that district. And this is just one example with one district. Laura's going to go ahead and highlight other districts that have been successful in multiple areas as well. We get questions, what type of services, so counseling, skills training, referrals. We also have the privilege of participating in ARD meetings. And this has helped us really bridge between education and mental health services and really being able to promote those positive outcomes when it comes to kids feeling emotionally successful, academically successful, and just well in general. We know that kids do better when they're supported in multiple areas, and what we have seen is that, you know, moving forward, our outcomes continue to be positive.
And so I'm going to go ahead and speak now to Cameron and Willacy. And so the Cameron area that I'm talking about is in the Harlingen area, and Willacy encompasses Raymondville and some outlying areas. And so the co-located school manager project started in Cameron County with Harlingen CISD in 2013. And so at this time, the purpose was for Tropical to provide the case management and the skills training in the school setting in order to reduce the amount of time the student was taken out of the school. And so when we first ventured into dealing with Harlingen CISD, the issue was that no other entities were allowed in the school unless the child had a probation officer or a child protective services case open. And so we were able to meet with the head school counselor and the assistant superintendent at that time and work out a plan instead of trying to have our case managers or our parents bring the students, check them out of school, just to come to the office to meet, to do either skills training, counseling services. We were able to actually come to an agreement and collaborate by placing case managers within each school that they identified in order to provide those services on campus. And so it was a really great beginning collaboration. They allowed us into 6 elementary schools at that time. And so that was kind of our kickoff. So that was really nice to not see that the kids were not missing an extended amount of times out of school, as well as they were only being pulled from, from their core classes. In addition to this, around that time, we were able to also use those case managers that were located in the schools to provide crisis screenings and assessments when needed for any kids that were in services or not in services. So then each year since 2013, we were able to grow as they saw a need, and of course those different principals would talk to the other school principals about how great this was helping their programs and helping reduce hospitalizations, kids being out of school, and so on. And so today we've grown to over 15 schools. And the really nice thing when we spoke in 2013 was that they didn't need us in the junior highs and high school because they already had behavior analysts in there. And as of today, we're in all of their junior highs and high schools as well. And so when we reached out to the Harlingen School District, we decided to reach out to the Raymondville School District as well, and that took place in 2016. And that purpose was a little bit different. Raymondville is about 20 to 30-minute drive from our main office, and so a lot of need that we saw with those individuals was lack of transportation, and so parents were not being compliant with their children's services. And so the Raymondville School District was able to get on board with Tropical and sign an MOU in 2016, and we were now able to provide all of those services. And since then, we've been able to cover all of their 4 schools. It is a smaller district, and we, as well as do intakes in both districts, the Harlingen and the Raymondville, to reduce parents having to travel so much as well.
So go ahead, Laura. Go ahead.
So how does it work? So what we started was basically getting a memorandum of understanding, which is created between the school district and Tropical Texas. And so this outlines the parameters in which the district and Tropical will work together in providing mental health services to these students. It details the capacity to what the school district will accommodate, as well as any HIPAA and keeping FERPA guidelines, and they are renewed yearly. And so the school district, each of the school districts that we're in has established a referral process in which it's followed to provide students access, as well as parents, to services on campus. Because another secondary gain that we were able to get is, in speaking with parents, parents are also as well referred to our services as needed as well. And I'll pass it to you for the rest of the slide.
So just looking at, as Laura mentioned, really making those connections between making sure if a need was identified by a counselor, by a social worker, by a principal, by a teacher, that those needs were met through that referral process, and that it was, we were really tackling those barriers. As Laura mentioned in the last slide, transportation was something that was a big barrier for a lot of our rural areas. And so by doing this and by taking the services and planting them into the districts, we're actually knocking down those challenges and barriers that are associated with maybe not being able to get to the clinic, maybe not being able to access those services when needed or as frequently as needed. So that really helped navigate that for families as well. The other thing that we were able to tackle was removing the stigma. A lot of our families didn't want to go to a clinic because they said that was tied to stigma with mental health. A lot of families also had cultural barriers that they said, my family doesn't want me to seek help because of, my culture, or because of a specific barrier associated to their culture. So by having those conversations in a setting where they were very familiar with, they have to drop off and pick up kids at school, they have to have meetings on campus. It really helped make that transition more doable for families. It helped remove that, and that was a big piece of it as well, a big component. And looking at the services that were provided to kids on campus, that included CBT, skills training, routine case management, wraparound services, crisis intervention services, COPS-D services, so services associated with substance abuse. A lot of our rural areas had this unidentified need. Where do we go seek substance abuse services? Where can my kids get the specific help? And so families had a lot of questions pertaining to different types of services. A lot of them didn't know these services were offered in their community. So while we were able to have those smaller conversations, what ended up happening was the outcomes kind of went from community to community, from school district to school district. And so that's how that kind of panned out and helped us tackle those specific challenges associated to getting services to the folks that need them. So looking at McAllen ISD co-located team, and again, this is one example. Laura's going to speak to a couple more examples, but we started out in these elementary schools and one high school. Since then, we've been able to tackle 20 different campuses, and right now we have 14 staff that are co-located on our McAllen campuses, along with servicing over 400 students, and that was fiscal year last year. So projections continue to grow. What we start to see is we see kids doing academically, their grades are getting better. We see attendance continue to improve. So as Laura mentioned earlier, keeping those kids on campus was part of a big reason why we really wanted to partner and make sure that it was effective, because we didn't want kids to miss out on lecture time. We didn't want kids to miss out on opportunities to complete their grades. A lot of our kids are in credit recovery, and we need them on campus. We need them there doing their assignments. And so this really helped push for that co-location, because they saw it as an ally to make sure that they're meeting their metrics along with us. And so they said, hey, if you can help with attendance, if you can help increase their behavior on campus and really meet those needs, it was something that they found very beneficial really early on in co-locating. They saw the difference. They saw that their kids were at school on time. They saw that the parents were engaged. Keeping parents engaged is sometimes a barrier or a challenge, and with this one, we started to see, families were taking that initiative and having those conversations with teachers and administrators. It allowed for more, just to really tackle it all together as a treatment team versus siloing it. Well, these are, educators and these are mental health folks. No, we're in one community and we're trying to make that systematic shift. And so that helped us greatly.
Okay, and now what you're looking at is our Harlingen and Raymondville school list, and then this was last year as well. I think the new one has added about 2 more schools, and so we're really excited. And then, of course, the picture of some of the caseworkers that are located in those schools. And so we've really seen, like I said, an increase, even being able to get more information to the school counselors, the administrators about mental health, about, behaviors, about trends in school. And so some of the things we have upcoming this year is actually at the beginning of next month, we're going to have our counselors, our center counselors go in and do a presentation for all of the Harlingen school counselors on what trends have been seen in the clinic in regards to, what the kids are talking about and like, for instance, bullying, peer pressure about using drugs, body image. And so they're going to do a presentation to all of the Harlingen School District school counselors in order to kind of have them more aware of what their students are facing. So it's been a really great collaborative effort. And like I said, just the fact that all of the co-located teams have continued to grow on a yearly basis really shows how successful this has been for each of the school districts.
Just taking a quick look at pros and cons and looking at progress on campus. So some of the things that Laura and I have noticed, and our managers at other sites have also brought this to the table, having access to the campus has really stopped any barriers associated to timing. We know kids are on campus 8 hours of the day, and so we know that the majority of their needs presented academically, mental health, socially, will arise on campus, and that's helped us really tackle that timing portion. Looking at building rapport with your campus counselors and principals, Laura did speak to having a good relationship with those administrators. That was very helpful. Securing space to visit with clients and families, removing that stigma from having to go to a mental health facility. Some of our families do prefer to meet in a more public setting or a more community-based setting, like a library or in the community. And a school is somewhere that, again, it's a very common ground. They're on campus. They feel at ease. Services are being provided, and no one is missing out on an opportunity to access services. Access to students' grades, attendance, and referrals. This helps with tracking progress and monitoring, okay, if we need to assist in doing an additional referral to a specific service, we're working as a team collaboratively, making sure that those needs are met versus, again, that siloed approach where not everybody's on the same page. A lot of the time it's hard to get everybody in the same book, let alone on the same page. And so frequent staffing with school counselors and principals helps to de-escalate crisis quickly, to move forward instead of maybe placing the student off campus at an alternative school or inpatient. So what we're seeing is immediate intervention works, and that having staff on campus really minimizes that need to go elsewhere versus, okay, well, they're going to have to be taken to an alternative campus because of an incident that could have been managed with the core team. And so what we're seeing is administrators are very receptive to that. Laura, do you want to speak about a little bit of the cons?
So some of the cons are there is times when they're testing and they do have benchmarks and star testing. Not to say that an interesting fact about this time is that around this time of testing is that we do see an increase in crisis screenings. And so we're able to be on the campus to assist with that. But we try to have the caseworkers focus more on meeting with the parents, doing their normal check-ins. At that time, school making last-minute changes to space availability and removing tropical staff from secured workspace. So every once in a while, depending on, we have had situations where they're like, okay, well, you know what, you can go sit in the library. Of course, it's not secure there. I think in one school we had a situation where they were kind of putting the caseworker on the stage behind a curtain, and so it was just kind of addressing, you know, some of the issues that, you know, we can't really have that kind of space, but for the most part, it's really worked out. And then I would say some of the issues around crisis is that sometimes schools will feel really comfortable with a hands-off approach, and maybe they'll direct to the case manager when the concerns are behavioral and not appropriate for a crisis screening, and so they'll try to get the caseworker to get more involved with that. And so we've had to kind of establish, okay, are you requesting a crisis screening or not requesting a crisis screening? And then, of course, as you know, in the last couple of years, we've had a rise of you know, unfortunate incidents in the schools, you know, with active shooters and suicides. I mean, it's everyone's gotten a little bit more sensitive, and so they're really trying to figure out, you know, what constitutes a crisis or not. And so, again, those are just some of the cons, but to be honest with you, the pros really overweigh it in the end.
So this is just a list. These are ongoing partnerships. This is a small list of our districts that we serve throughout the Rio Grande Valley, including 3 counties. And we just kind of wanted to, the list continues to grow as we continue to add idea campuses, charter schools, private schools have engaged us. So this was just a short list of some of the districts that we're partnering with already, and we wanted to include that as well. So looking at mental health first aid, we utilize, I know a lot of folks have heard about mental health first aid. They know that this training exists. They know that we've been partnering with educators to provide mental health first aid in our communities. We've used this as a tool to really educate our community members and to provide knowledge on mental health. We've used it as a tool to help meet those needs as far as accessing services. Some folks are now comfortable having those conversations about mental health, looking at breaking down those barriers and challenges to seeking services. We've utilized mental health first aid to build relationships and grow those partnerships within our community. In Willacy, Cameron, and Hidalgo County, we've made sure that this is something that we're mentioning, something that we're talking about. Our local law enforcement is provided with this mental health first aid as well, campuses throughout the valley. And so currently over 700 persons served and trained in the Rio Grande Valley. And this also provides a space to have conversations about mental health in general. Again, folks see it in the news, they see it in social media, we've seen more incidents, and so people are talking about it. People want to do something in their community, and this is one of those first steps that, you know, sometimes principals reach out and say, hey, can we have this mental health first aid training for educators and non-educators? So this is a big piece. Diana Zamora is the one who spearheads this, and so we really utilize this as an avenue to have those conversations. And the next slide is just kind of breaking down, looking at who we're reaching and who's having those conversations. And if you look at the schools here, it's 11%, but in our area, we actually, I feel like that percentage is a little higher because we are having those conversations across all 3 counties, and schools reach out very often to have part in this particular training. So any questions, guys? Thank you guys for having us this afternoon.
Thank you.
And as a reminder, you can unmute yourself and ask a question, or if you'd like to put in something in the chat box, that is great too. And while folks are thinking of that, I thought I might launch one. I know that you guys are a border community, and I'm wondering if you see a value in having services embedded in the schools in terms of the comfort or the safety that families who may be undocumented may feel in accessing services.
Laura, you want to speak to your experience with this particular population?
I can see where, yes, now with the shift and the changes and the atmosphere that's going on, I can definitely see where that can be beneficial. Unfortunately, a lot of the kids that we do serve, especially I want to say in the lower Rio Grande Valley, which is the Cameron area, and the Willacy area, they do have a higher percentage of probably undocumented students and families in the Upper Valley area, and so I think that that's become more of a side benefit. And initially, it was more about the transportation and the access, but definitely, I think that, you know, in speaking to your question in regards to the safety and those changes, yeah, definitely, I think it's a benefit that's happening right now. There is a lot of school districts that are very close to the border, and then we have some that, you know, are a little bit further away, but either or, you know, overall, because of the services being on campus, because I don't know if we were able to mention, even at this time as they're doing intakes, if we're not able to get a counselor to the school, we're able to use telehealth to do those diagnoses, and in some situations, you know, our doctors, our child psychiatrists do have access to televideo for telemedicine if needed as well. And one of the other things, and I know it's not a school setting, but we're also in Cameron co-located in the Juvenile Detention Center as well, and we provide those exact services with a co-located staff in there. And so we're always looking to expand those avenues.
Thank you. Anybody else have a question for Monica and Laura? Okay, well, we're going to open it up for questions again at the end, if you think of something between now and then. And so now, oh, go ahead. Okay, sorry. Okay, so now we're going to pass the torch, literally, or at least the control of the slides and presentation to Jessica Gentry from Bluebonnet Trails.
So good afternoon, everybody. Happy Friday. I'm Jessica Gentry. I am the Director of Integrated Healthcare and School-Based Services at Bluebonnet Trails. Molly, you can go to the next slide. So Bluebonnet Trails covers 8 different counties. We have a lot of counties, Burnett and Williamson, that are in the north, and then we focus a lot more on the east side as well as the south. So Williamson County is going to actually be our biggest county that we serve through a wide variety of services of Bluebonnet Trails, and then the second to that is Guadalupe County. So what you're going to see on the right-hand side is you're going to see all the different places that we have different services in, specifically in regards to school-based services. So what I'm going to be really focusing on today is where we have our integrated healthcare and in the schools itself, in a couple different schools, what that looks like. As I'm going to touch a little bit on the substance abuse services that we have licenses and we work and we provide substance abuse individual and group counseling in these specific schools. And as well as tropical, we also provide case management and counseling in a variety of different schools that we cover over 8 counties. It doesn't look exactly the same in all of them, as we also have different memorandums of understandings and different needs and different relationships with the schools. But I will say that we believe at Bluebonnet Trails that our school partnerships are the most important to us. Okay, so we're looking at youth and family services at Bluebonnet Trails. Obviously, we serve a wide range of needs. I'm not going to go through all of these, but I'm going to touch on some. One of the pieces is holistic and integrated healthcare. And so integrated healthcare includes the whole person, of course. And so we're looking at behavioral health, intellectual and developmental services, substance services, mental health, of course, primary care, which includes, brief solution-based counseling. We're going to talk a little bit about that, and dental and primary care. We also offer a program, the YES waiver, where really focuses a lot on the children that are at risk of being in placement, and substance abuse screenings, services to families of veterans and transition age youth, and a lot of disaster services. The disaster services are really going to cover when we have a natural disaster or any violence in the communities. Bluebonnet Trails works very closely with our sister mental health authorities across Texas, and we provide the support that's needed, whether it's in actually one of our counties that we serve or not. That's okay. Oh, that's okay. I was going to talk a little bit about the crisis intervention and respite and hospitalization. We're going to look about that a little bit longer later in the slides, but we obviously provide crisis intervention, and that's in the community and one of our clinics, and of course in the schools. We also have different crisis respites. We also refer to those as emergency observation units, and we have those for adults and children. And obviously our crisis workers really work really closely with the families and the schools and the students, of course, and if there's a need for hospitalization for mental health concerns. Okay. So telemedicine, I really don't think that we'd be able to do the amount of services and the amount of person-centered approach that we have at Bluebonnet Trails if we weren't able to use telemedicine. Even though Williamson County is pretty urban compared to a lot of our other counties, you know, in the rural areas, having access to psychiatry, having access to, you know, really like mental health services in general is really difficult. And so what we're really looking at in our rural counties specifically is how can we make sure that those in services and those needing services are getting the same level of accessibility and care as those living in more urban areas. So you can see that when we were looking at the numbers from, you know, this past October, looking at 9/1/19 for, I think that should be 18, the 6/4/19, we served 7,162 unduplicated patients receiving outpatient medication service. And so what that means is we have psychiatric nurse practitioners and psychiatrists who provide telehealth services to adults and children. And what that, I mean, so that looks like medication management is a term that's used quite often. We also provide counseling via televideo. We really, anything that we can really grab our laptops and set up any system that we can in order to reach those folks that accessibility is really a concern. We just really make it happen. Okay. So our youth and family mental health services. So for children, for behavioral health, we're seeing 3 to 18 years old who have a severe emotional disturbance. We also have ECI services, early childhood intervention, and that serves children from 0 to 3 years old. So if you have a child who still needs services for mental health, behavioral health, then we'd be able to easily transition them from the ECI services into our traditional mental health services. So families are receiving case management, skills training, medication management that we were talking about a little earlier, our nurturing parenting program, our family partner services, and counseling. The family partner services are specifically a program where you have staff members who have lived experience of having a child in the mental health system. And so they work alongside of the treatment team as a whole. And the family partners are, you know, could be going to the schools, they could be going to particular meetings, as well in our clinics. But you would really see our family partners like around a kitchen table and really focused on the needs of the family within their, you know, their actual environment. The services are tailored based upon assessed need. So, you know, if we're seeing that a family seems to be doing a little bit better and they come into services and some really difficult things happen in the family that kind of shift some pieces and have more challenges, then we're going to meet that need. We're going to make any changes that we have to make in order to make sure that those families get the services they need. Before a youth turns 18, the recovery team prepares them to transition into adult services. So we might have a child that's in the services with Bluebonnet for quite some time, and they understand that when they turn 18, the care that they'd be receiving may look a little different, as they're going to be part of our adult mental health program, which means that they're going to be having a different case manager potentially. But really what we do is we look at each case specifically, and the recovery team really prepares that particular client. So, if it doesn't make sense and it would actually negatively impact the individual's functioning, emotional functioning, and physical functioning, then they may continue to have the same youth and family case manager for the next few months until we do a proper transition. Okay. So the challenge really is, compared with their peers, students with a mental health disorder are more likely to experience, underemployment, experience homelessness. They may completely drop out of school and unfortunately become involved in the justice system. What we're looking at is 1 in 5 children ages 0 to 11 experience a mental health disorder in a given year. 70% of the youth and juvenile justice system suffer from mental health disorders. 27% of these youth experience so severe that their ability to function is significantly impaired. They may not be able to get out of bed. They may be starting to experience early onset of a severe mental illness that they're going to have with them for the rest of their lives. And 10% of children experience some impairment in daily functioning at home, in school, or in the community due to mental health problems. Really what we're seeing with that is we're seeing our children, that may have experienced some kind of shift in the family system. We're looking at potential divorce, extreme poverty, a family member being deported. So there could be some real shifts in the child that may be doing really well at the beginning of the year, but then really needs more additional support based on a lot of stressors at the home or at school. So our motivation is really co-locating healthcare services with an independent school district. We really want to make sure that it's affordable and accessible and that we're looking at the whole person. So a child is already served with high frequency by educators and counselors. Families are connected and familiar with the schools and experience convenience through reduced transportation and coordination and time away from work. And you're going to see this in a moment, but if you have a child that, may be having, need an acute care exam for, they might think they have the flu or something like that, that being collated and co-located in the schools for integrated healthcare means that the parent might only need to take a certain amount of time away from work, not the entire day, all around one doctor's appointment. If a child is feeling ill at the beginning of the day and we fear that they may be contagious, they can be seen right away within our primary care system and then might need to go home in order to be able to, rest and feel better. Our educators and counselors have been trained in identifying symptoms and mental health concerns. And the schools are supportive through referrals and strategic planning to meet the needs of families in the community. That's really where thankfully that's where we are in a lot of our places, but in the very beginning, those were our motivations. So we're going to look at the Elgin Independent School District, and this particular school district resides in Bastrop County. So the team, we have medical services with 2 advanced family nurse practitioners and 2 medical assistants. We have a specific and very special partnership with the federally qualified health center, and that's the Community Health Centers of South Central Texas. We also have dentist and dental hygiene services. It says underway through FQHC, but we actually, you're going to look at them. I took a lot of pictures so everyone can see what the mobile dental unit looks like right now. That sits on the same campus as our clinic, but we're actually going to be able to expand those services pretty soon and actually have a whole new building with with a lot more dental available. We also have our mental health and substance use screening and counseling through licensed clinicians with Bluebonnet Trails are also in the same space. And we also provide, psychological assessments and ABA, applied behavioral analysis for children with autism. We can also come to the clinic and provide that service. So really the strategy is that we wanted to place the Family Health Center is located in an Elgin ISD administration building. And so it's very easily accessible. It's right across the street from an elementary school. And it's actually in a school building where there are a lot of classrooms, but at that time they weren't really needing those classrooms. But there are a lot of other staff from Elgin ISD that are housed there, including immigration services and a lot of other pieces for specialized populations. And so we did a renovation in order to make sure that we could have those 4 exam rooms and include the medical. And like I said, the dental right now is a mobile unit. And then two offices for Bluebonnet Trails staff, so that they could provide case management and counseling in the same space. We also really mirror, go back one more time. We also mirror like any of the same summer hours, any of the holiday hours, so that we're available and kind of follow along with what's going on with ISD. We have benefit coordinators who work with families under the FQHC program in order to be able to access CHIP and Medicaid and other health benefits. Obviously we're receiving a ton of referrals from the ISD for kiddos, but we're also seeing their staff. And once they come into the clinic and they see what it looks like and they have a sense of comfort with the staff and the accessibility and the affordability of the services, then we're seeing a lot of family members coming too. We also partner with them, in education. So we have a lot of the staff going in and meeting with the school counselors, on a regular basis. And we also have health fairs, and they're always inviting us to those health fairs. We have monthly meetings with the assistant superintendent and other key staff through Elgin ISD. And we have our FQHC partner in Bluebonnet Trails in those monthly meetings. So we're really looking at, what's going on in the school, that they may need more data from us in order to show that they're board that we're actually making an impact on the services we're providing. We might be talking about, our immunization drive coming up, or any like sports physicals and that kind of thing. Okay. So this is the therapy space in Elgin. So it's a larger one because you want to be able to make sure that families feel comfortable in that space. We also provide play therapy. You can't really see it, but it's like to the right, there's that little sandbox over there. And we have lots of toys so that children can pick what they want to play with and not worry about making a mess. And so everybody kind of feels like the space is like really warm and comforting to them. Next. And this is an example of the exam room. So because we work so closely with the ISD, we really see a lot of children at this particular clinic. And we do see a lot of adults as well, of course, but you can see that like there's little pictures of Toy Story and that kind of thing on the wall. We're trying to make sure that the space itself feels very, calm and comforting to the families, depending on who's coming in. Specifically because, when children aren't feeling well, the exam room isn't their very favorite place to be, especially if they're getting shots and that kind of thing. So we try to make it as a welcoming space as we can. And this is the mobile unit. On the other side of this big truck is you have stairs going in, and then we have 2 dental chairs. So a dentist and then a dental hygienist can be working at the same time. And it's actually getting an accessibility ramp being put on it right now. So anybody and everybody would be able to access that service. So when we're really looking at the outcomes and looking at what our previous motivations were and like what we've accomplished over the past 4 years, going on 5, there was a reduction in days of school missed. Pre and post data for the growing district indicated that the number of missed days of school was reduced by 12% from the initial school year. Children enrolled in the ISD were able to achieve the immunization expectations. I don't have the most recent data from the 2018 to the 2019 school year, but you can see that over time, beginning of our partnership, that we've actually made an impact. And what we usually do in that particular kind of situation is that we have the medical providers will block out certain days that coincide with, orientation and registration. And so any of the children that don't have the vaccinations that they need can just walk over to the clinic and get what they need right then and there. They don't have to wait for an appointment. So we get everything ready in order for that accessibility to be there. Obviously, the reduction of barriers to healthcare, that they're able to, go and get seen more quickly, that we have the FQHC has a lot of different programs that allow folks who don't have insurance to be seen without, causing them to have a huge bill that comes in the mail. A lot of increased education, mental health first aid was provided. 13 trainings were provided to Elgin ISD between 2017 and 2018. And the number of persons served through same-day access was 1,956 children and adults. Overall, on a Monday through Friday basis, they're seeing about 35 to 40 patients per day in Elgin. Okay. So we're going to look at our next partnership. So we have the Family Health Center at Hutto ISD, and that was a clinic that opened in August of 2014. So this particular, it's a really special, and this is in our northern county. So this is right now, Hutto is located in Williamson County. So it's a little bit more of an urban area in comparison to Elgin. So this was really a unique opportunity for Bluebonnet Trails. We were invited by the ISD, by the superintendent, to come and use a space that they already had created and set aside for primary care services that is located in the actual high school. It's a separate door, so the door you're looking at in this picture is different from the general door for the school. So there is that sense of privacy and security. So the Hutto ISD, serves almost 7,600 kiddos. 10 campuses, and you can look through all the demographics of how it breaks down and, what that looks like in that particular ISD. So what we are offering in the Hutto integrated healthcare services, obviously we have primary care, so we have a full-time nurse practitioner that works in that space. We provide immunizations, physicals, very similar to Elgin, is that when there's registrations or there's any kind of event going on at the school in preparation for the new year, we're blocking off specific days and having no scheduled appointments so that families can come over and the kiddos can get their immunizations and any school and any physicals that they need. We especially block out that time, especially around because a lot of sports start a little earlier. And so we get those sports physicals done. So we have behavioral health screenings and consultation. We provide counseling right there in the clinic. So we see, and we really make it a priority to take any of the referrals coming in from all the different campuses throughout Hutto ISD. We work really closely with the school counselors. Of course, a crisis intervention. We provide intakes of psychiatric diagnostic evaluations when we're bringing children and youth into services. And we also have, provide that in person, but we can also provide that via televideo in that space. And we also provide medication management with our psychiatric providers. So this is what the waiting area looks like. So when you walk in, it feels like a warm space and it doesn't feel stark. We really want it to be very similar to, any other kind of integrated healthcare office. We have, stuff for the children. We have television going the whole time with different movies and that sort of thing. Just try to make sure that people feel comfortable. And it's a joint waiting area. I tried to take a picture of the waiting area in Elgin, but there were a lot of patients in there, and so that wasn't going to work. But when we're looking at our integrated healthcare spaces, whether they're based in the school or they're throughout our different communities, which we have, it's one whole waiting area. It's not separated by people getting primary care or folks getting dental or folks receiving crisis or behavioral health or IED services or substance abuse. It really breaks down that stigma of mental illness and allows people just to have a sense of privacy. We cross-train our front desk staff so that they can check people in, whether that's with the FQHC partner or with Bluebonnet Trails. There's really no wrong window and there's no wrong door. And so we really tried to carry that with us when we were, creating a waiting area like this. This is an example of one of the exam rooms. And this is the therapy office. And so right now, everything looks a little bit different. There's a lot more play, for play therapy, but there's a couch. It's a little bit larger. So it really allows for like a group setting or family counseling or couples counseling. And so that the therapist can get right on the floor and work with the child. Obviously, Sandtray can be used in a wide variety of ages. So you might see a teenager that they're using Sandtray specifically for looking at a child that's a teenager or younger that experiencing some kind of trauma. So we want a space that kind of inhabits all of those different kind of interventions. So we also have additional partnerships. We have one with Lockhart and Prairie Lee ISD, and I think I left that off by accident. And then we have a really new and very exciting partnership in Round Rock Independent School District. So Lockhart is located in Caldwell County, and that's one of our more rural areas. And we had an opportunity with the HAW grant to really provide counseling services in the school using in-person and televideo to make sure that the referrals that are given to the counselor, the time between when the child sees the counselor is really short, and it's more accessible because it's within the school itself. So I just kind of gave you an example of, on the left-hand side with the blue, like what that workflow might look like. We talked a little bit about family partners in the beginning of this representation. They're the ones that have a lived experience, and so they're meeting with the families and the child at the school, counseling via televideo or on site. We're obviously doing counseling and play therapy on site elementary schools. So it kind of a wide variety of services for that. When we're looking at the workflow for Round Rock ISD, so this is a brand new partnership that Bluebonnet Trails is very honored to get. This is Williamson County, so more of an urban area. And so we're gonna, and this is actually just starting, so this is a brand new workflow that I wanted to share. And so what we really are doing is creating different mental health clinics across the different campuses at Round Rock ISD. And I believe they're actual, like they cover like over 110 miles or more for their particular ISD. So one of the things that we're doing is really looking at having a Bluebonnet Trails licensed clinician, specifically who has a lot of different kinds of trainings and orientation, like for trauma specifically and ADHD, is we're looking at using the school counselors to refer the children and the youth to see the counselor in person on one of the mental health campuses, clinics. And so we're using a lot of different resources at Bluebonnet Trails. We have care coordinators that really help to break down any kind of gaps or barriers to folks being able to access the services that they need. And so I really just want to speak to that really briefly. It's really exciting for us, and we're really excited to be invited into the school district and have our counselors spread out throughout different campuses there. We're starting in both of their high schools right now. I'll speak briefly about this. I know we're running out of time. So our substance use recovery, we do a lot of different pieces like that. We have, one-on-one peer supports and groups with a recovery coach. We have case management for co-occurring psychiatrics and substance use disorders. We do a lot of outreach and screening, whether that's in person or through our work with OSAR. We have licensed chemical dependency counselors on our crisis response team. So they're bringing that particular experience and orientation into the room when we're working with folks. And we actually have an inpatient ambulatory detoxification center that just opened up in Williamson County. So we hired an addictionologist actually to help us in that particular space. So we have a lot going on. We're really excited about it. We can go to the next slide. So when we're looking at substances the most commonly used by youth admitted to Bluebonnet Trails, which are probably very similar to what y'all are seeing in your own communities. Alcohol is the highest, but right below it is marijuana, cannabis, benzodiazepines, 12%, opiates, 6%, and other 11%. And when we're looking at other, we're looking at a lot of over-the-counter, different kind of medications that, in combination or used excessively can obviously, cause one person to get addicted to it. So our substance use services in partnership with local ISDs. So when we were looking at that substance abuse service array, we can provide those services on campus, just kind of a one-time thing or a small group, and obviously in our clinics or anywhere in the community. But we really wanted to partnership with some of our ISDs that were willing and open to it. And what we do, we have to get a specific license to provide those services on those campuses. And that's a license that we get through the state of Texas. So we did that with Lockhart ISD. So we do groups and individual work there. Bastrop ISD, Burnett ISD, and Seguin is coming soon, and then Nixon Smiley, which is a really rural area in Guadalupe County. We're going to be partnering with them and have a license very soon to provide services there. So really, kind of wanted to move this little window. There we go. So, what are our beliefs? We believe in our kids. We believe partnerships bring extraordinary resources to our students, making them stronger. We believe in motivating our kids not to give up. and we really genuinely believe that resiliency can be taught. So even with those hard days, you know, we carry this with us all the time, and it makes sure that, you know, we have that consistent motivation with everyone that we're serving and with all of our staff. So any questions?
I'll just, while folks are preparing their questions, I want to share Monica's comment. She said she really loved the picture of the space that you had, that it was very warm and really kind of showed kind of what it looked like.
Thanks. Pictures are good.
Others, feel free to unmute yourself and share a question if you have for Jessica.
And there's also my contact information at the bottom. So if there's any other questions that you may have, you know, you can always give me a call. That's my work cell, or you can email me.
And I want to note that a few people are having some trouble accessing the CEU form. So if you're able to hang on for just a second, I'm going to try and put that link directly in the box, in the chat box. And I would ask folks to please go ahead and fill out the survey. That really is our way of documenting that you were a part of it and for our CEU process. But if you hang on for a minute, I will try to get that link for the CEU into the box. Otherwise, I want to say a very big thank you to our presenters today, to Laura, to Monica, and to Jessica for sharing the wonderful things you're doing in your communities. I think if folks have questions and wanted to send them to us at the South-Southwest MHTTC, which is here, we would certainly pass them on to Jessica and Monica and hopefully get some responses back for you. You may percolate on it and think about it. And I also wanted to share with folks that our very last part of this webinar series is coming up in a few weeks. Let me see if I can go backwards. And in that particular one, we're doing a shift and share. So what that means is we're going to be inviting all of you guys who are participating to hopefully share a couple of minutes about what may be happening in your communities in connection with schools and providing services in schools. And so we'll get to hear kind of a speed round of some of the incredible work that's happening within our region. So thank you again today for being with us. And if you're able to hang out for a few more minutes to get the CEU certificate, we'll be posting a link. Thank you.